Next, we have Dr. Parvathy B. Raj. Her paper is on pachymetry changes following corneal collagen cross-linking for progressive keratoconus.
Good morning all. Our study is about the pachymetry changes following collagen cross-linking in progressive keratoconus. Collagen cross-linking aims to improve the intrinsic biomechanical characteristics of corneal stroma in order to stabilize progressive keratoconus. The accepted criteria for undergoing a conventional collagen cross-linking include topographic evidence of keratoconus progression, corneal thickness more than 400 micrometer, and keratoconus without deep stromal scarring or history of corneal hydrops. The steps include, after instilling topical anesthetic drops, the central 7 to 9 mm of the corneal epithelium is debrided using a spatula, sparing the limbus. Then 0.1% riboflavin drops are instilled for about 60 seconds, and the riboflavin soaked corneal epithelium is irradiated with a UVA radiance of 370 nanometer with a total dose of 5.4 joules per centimeter square is applied. So here the riboflavin acts as a photosensitizer which limits the depth of effect, and the UVA radiation will helps the riboflavin to form free radicals and a singlet oxygen, which will helps in the formation of stronger covalent cross-linkings. So even though there are many protocols, we currently follow the one which is found to be effective and comparable to the conventional Dresden protocol, that it delivers about 9 millivolt per centimeter square for 10 minutes, and the conventional Dresden protocol delivers about 3 millivolt per centimeter square for 30 minutes. The criteria used to document progression according to the global consensus on keratoconus and ectatic disorders include a steepening of anterior corneal surface and steep K of more than 1 diopter increase from the baseline for about 1 year in a 1 year period, and a flattest keratometry of more than 1 diopter increase from the baseline, and a mean keratometry of more than 0.75, and a manifest spherical equivalent of more than 0.5 diopter increase from the baseline, and also includes the thinning or changes in the pachymetry of more than 2% from the baseline, and at least 2 of the following should be there. We tries to establish that even though the pachymetry decreases following cross-linking, the keratometric parameters remain stable. Hence, pachymetry changes cannot be considered as a criteria for progression after cross-linking. We had done a retrospective study for about 1 year, and 59 eyes of the patients with progressive keratoconus who underwent C3R are taken into account, and pre and post operative, that is after 1 year, pachymetry values and simulated K values in the steepest meridian are taken into account. And we found that the mean maximum steep K parameters were decreasing from the 55.6 to 53.9 with a pair difference of about 1.68 diopter with a p-value of 0.01, which is found to be statistically significant. That is, the keratometry is the progression of keratoconus is halted. And the pachymetry is found to be decreased from 438 to 411 with a pair difference of 26.6 micrometer with a p-value of 0.001, and which is also statistically significant. So the decrease in the mean pachymetry and the slight widening of the range suggests that the treatment resulted in a significant thinning of the cornea in keratoconus patients, and this finding aligns with study's primary objective, which states that pachymetry decreases following cross-linking while keratometric parameters remain relatively stable. Similar studies done by Wolenczak et al., Hendricks et al., and Albright et al. Also showed that the pachymetry values were decreasing following cross-linking in a 1 year period, and the keratometric parameters were remaining stable. So, to conclude, the collagen cross-linking is effective in stabilizing corneal shape in keratoconus patients despite a significant decrease in corneal thickness, which suggests the need for changes in the criteria to assess the progression after cross-linking. These are my references. Thank you.
You have used what? Pentagram or again the scan? Pentagram. Then cross-linking, you had any opacities? No. Developed? Because in pentagram, the thickness of cornea may vary from the opacity. From the opacity, you can have the measurements sometimes.
In 1 year period, opacities were not noted.
Not seen.
So your conclusion is need not to worry about corneal thickness, no? That is the actual process of cross-linking because it increases the strength of the cornea. So you will be only followed up with the keratometric reading, topography. Okay. You will be following so that there is no need to assess the corneal thickness in follow-up. Yeah, if it is you are not considering as a significant thing, you can stop following up the